Good evening and welcome to our webinar on highlights from the Tourette Association 2016 Education and Advocacy Conference. My name is Ali Gemma, CDC Program Director at the Tourette Association, and I will be your presenter this evening. This webinar is being provided as part of the Tourette Health and Education Program, a program of the Tourette Association in partnership with the CDC. As indicated in the title, tonight we're going to be giving you some highlights of the recent national conference that was held March 8th to the 13th in Arlington, Virginia at the Crystal Gateway Marriott. You can follow all the action that took place at the conference using hashtag TouretteConf16. Whether you attended the conference and would like to keep the momentum going, or if you were unable to attend and would like to hear a recap of what happened, you're in the right place. We also have Megan Burns, Digital Director of Marketing, and Kathy Giordano, Education Specialist, who are available to help answer questions during our Q&A segments. We really would like to hear from you and include your voice in the conversation. So ask questions or share comments using the question and answer panel on the right side of your GoToWebinar player at any time during the webinar. We will collect your questions and address them during the Q&A session at the end of today's presentation. We will also introduce a few polling questions, so those will pop up right on your screen. And I've also included today's set of slides as handouts, and that's available for you to download in the handout section of your control panel. Before we begin, I just want to mention that funding for this webinar was made possible by our cooperative agreement with the U.S. Centers for Disease Control and Prevention. The views expressed by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. So now, let us begin the presentation. So to start off, John Miller, President and CEO of the Tourette Association, would like to give a quick message to everyone. John was not able to be on the webinar tonight, but in lieu of his absence, we were able to grab him for a minute earlier today through this video. And in case you are having difficulty hearing the video in the presentation, I've also included the video as a handout that you can download and watch separately.
Hi, I'm John Miller, President and CEO of the Tourette Association of America. I hope you enjoyed the 2016 National Conference as much as I did. I was truly touched to see our mission in action. If you didn't have the opportunity to attend, Ali Gemma will be providing a great overview of the conference events and takeaways. I look forward to the impactful work we'll do together to raise awareness and make life better for people with Tourette and tic disorders. Thank you.
So thank you to John, and we really have some wonderful things going on at the Tourette Association, but more on that later. So I just want to get a sense of whether people attended the conference. So I'm going to launch our first poll question. So 1 second here. So did you attend the conference? Yes or no? We'll just take a few minutes, or a minute, just to see if people respond. So it looks like we have a no. Just give it a few more seconds. All right, so for now, 100% said no. We'll go ahead and close that. So the Tourette Association, we hold the Education and Advocacy Conference every 2 years. And this is a really great opportunity for the TS community consisting of professionals, families, individuals, and other key stakeholders to come together to share experiences, to learn about the latest research findings, strategies for living with TS and tic disorders, and really a great way to connect with each other and meet others. So now I'm going to launch our second poll question. So what is your relation to TS and tic disorders? So we have parent or relative so far. Just let a few more people respond. Okay, great. So it looks like we have mostly parents or relatives. So this year, you may have noticed that we've changed a few things. Our name, our new logo, we have an updated mission statement of making life better for all people affected by Tourette and tic disorders. And we accomplish this in several different ways, from empowering young people to advocating for supportive public policies, increasing public understanding and knowledge, and building supportive communities and networks. So the first part of the conference was really geared towards advocacy. We trained 43 teens to be our next group of youth ambassadors so that they would be equipped to talk about Tourette and tic disorders to peers at school, friends, camps, and other groups. We also held a chapter leadership meeting, strengthening our relationships with 30 representatives from chapters and support groups. And finally, individuals and families had a chance to go to Capitol Hill and meet with congressional representatives to advocate for public policies and services promoting awareness, research, and support for the TS community. 132 meetings were actually held with representatives at Capitol Hill, 60 in the Senate and 72 in the House. And we had 156 advocates from 31 different states. There were also 615 letters that were sent in by 152 state advocates and 13 phone calls as well. Additionally, we asked everyone to participate in the hashtag Rally for Tourette social media campaign to show their advocacy support over Facebook, Twitter, and Instagram. And we received over the entire conference, we had 1.5 million impressions on social media. So that's quite impressive. Now, the education portion of this conference kicked off with the newly diagnosed seminar. This webinar was presented by Dr. John Walkup, Director of the Division of Child and Adolescent Psychiatry at Weill Cornell Medical College and New York Presbyterian Hospital. Dr. Walkup has been a longtime medical colleague of the Tourette Association, and in this seminar, Dr. Walkup covered topics of diagnosis, treatment, co-occurring conditions, and behavioral issues. And participants of this seminar included parents of recently diagnosed children, recently diagnosed adults, young adults, and maybe first-time attendees at the national conference. And if you actually weren't able to attend the seminar, we do have this information available through a video that was filmed at our 2012 national conference. And that's available on our newly diagnosed / getting started webpage under the About Tourette tab at tourette.org. Later in the evening, there was actually a meet and greet open to all conference attendees, and many attendees commented that they had never met anyone with TS or tic disorder before, and were actually excited to meet new friends and make new connections. And then Friday and Saturday began the educational sessions over 5 tracks, which we'll come to in a minute. So during the conference, we also held exhibit tables where organizations could disseminate information about their cause, offer wonderful resources to folks, and network with attendees. And we were extremely thrilled to have Brad Cohen as this year's keynote speaker. Brad spoke about his personal challenges and his unwavering perseverance to prove that he could follow his dreams to become a teacher. So he was very inspirational to everyone in the room. And then the last night of the conference was fun-filled with a banquet at which we celebrated with awards, live music and entertainment, and good food and conversation. So now I'm going to give you a recap of some of the sessions that were held on each of the sessions. And so I'll start with the medical track first. So to start off on the medical side of things, co-chairs-elect of the Tourette Association's Scientific Advisory Board presented an overview of the latest scientific and clinical research on TS, tic disorders, and related conditions. Some of the new developments in these areas included genetics, neuroscience, and related disciplines, as well as new treatments for these conditions. And because often TS is more than just tics that tend to cause substantial challenges and impairment, The TS and co-occurring disorders session discussed the various conditions and how they can be managed through medical and behavioral therapies. Families who were interested in the behavioral therapies attended a session that talked about the availability and the effectiveness of behavioral therapies for both tics and non-tic symptoms associated with TS. And then to go into more detail on the behavioral therapies, Comprehensive Behavioral Intervention for Tics, or CBIT. One of the co-founders of the CBIT therapy gave an overview of the non-pharmacological approach for managing tics in children and adults. He discussed some of the latest CBIT research and even did a demonstration of CBIT showing the audience how it can work. And you can find a previously recorded video of the CBIT sessions that were filmed at our 2012 National Conference on our website as well under the medical tab. So the second day of the medical track included a session during which attendees had an opportunity to submit questions to a panel of physicians with expertise in Tourette and associated conditions. Questions ranged from treatments to finding a provider. This was a very open and interactive session and very well received. Other sessions of the medical track discussed medical and surgical therapies, including drug therapies and deep brain stimulation, or DBS. A session on occupational therapies was also held. Occupational therapists are well equipped to learn CBIT and implement it with their patients. So this session discussed the ways OTs can offer support services to those with TS. And then finally, on the medical track, members of our CDC partnership team talked about how we can use public health approaches to promote TS education and awareness, how research informs our Tourette health and education program outreach efforts. So that's quite a bit of a rundown of what sessions were covered on the medical track. So now the education track was filled with very important sessions to help students with TS succeed in school. On day one, the first session discussed various classroom strategies and accommodations that could be implemented in academic settings, and these support the students' learning and educational needs. As students and parents start to prepare for college, a panel of education professionals offered guidance on receiving appropriate accommodations. Some points of discussion included talking about the dreaded SATs, the various services that are meant to help students with transitions from high school to adult life, and approaches to choosing the right college that offer appropriate support services. The education track also included a session on advocating for your child in school. So some questions that were answered were, what are the goals of an advocate, and how to be a good advocate. Many parents are not familiar with how to write or obtain an individualized education plan, or IEP. So one of the sessions discussed strategies and what services can meet the needs of students with TS. Assistive technology can also be a great benefit to a student who's learning, and so one workshop introduced folks to various applications that are actually available to help with organization, note-taking, handwriting, language, and other related challenges. The second day of sessions on the education track covered OT and speech services, how the occupational therapists and speech-language pathologists can support students with TS. Another session discussed the federal protections regarding discipline and manifestation determinations. The term behavior is very commonly used and actually can be one of the biggest challenges students with TS face. So this session discussed the need for positive proactive supports for successful management and problem solving. And then the final session of the education track highlighted the eligibility criteria of 504 plans and some of the typical supports. And just as a reminder, Kathy Giordano, who actually co-presented several of these sessions, will be available in a bit to answer any questions related to these sessions and education issues. So moving to the third track, it was mostly geared towards parents to help them understand TS and manage at home. So the first session offered an overview of the social skills deficits that some children with TS have, such as what to look for when seeking professional assistances, as well as some practical suggestions for parents. One session discussed strategies to help guide children learn skills to better self-manage their symptoms, such as knowing when they are stressed, which may exacerbate their symptoms, and using strategies to manage their stress. Other sessions of the The first day concentrated on overcoming challenges and seeing beyond Tourette, including ways to promote individual strengths and also self-esteem. We also recognize that families have added stress and challenges of raising children with TS. So one session talked about family resiliency, how families can prepare and adapt to cope and overcome these challenges. And then no doubt bullying has always been a topic of great interest, and so a colleague from PACER's National Center for Bullying Prevention offered parents tips to prevent and respond to bullying. The second day of the parenting track offered some relief with a session from two seasoned parents who shared what they learned or wish they had known when raising their children with TS, ways to offer loving discipline for all children who have TS, no matter what the age. Parents also got a chance to have an open discussion with fellow parents to discuss some of the things they've learned so far at the conference, especially since some might not have been able to attend all sessions that they wanted. This was a great way to share and learn from each other. And then finally, the afternoon sessions included a panel discussion that offered guidance for transition periods such as going to college, starting in the workforce, becoming independent. And many parents experienced that the meltdown or the episodes of explosive rage, so sometimes referred to as neurological storms. So the final session of the parenting track talked about strategies to navigate these neurological storms, and this can include how to predict, prevent, and or minimize these rage episodes. And then, as you know, Tourette's doesn't always affect just children and adults. Or children and adolescents. Some adults are also impacted by TS. And the adult track offered sessions to address living with and coping with TS as an adult. So one session discussed the benefits of maintaining general healthy practices that may help in managing TS symptoms. This can include diet, exercise, and sleep hygiene. Other sessions included areas of being aware of your rights in the workplace, and these protect you against discrimination. How to prepare yourself for situations that could arise in the workplace. And then there's another session that talked about managing executive functioning, which can mean organization at work, at home, and even relationships. Another great session included a musical workshop where folks learned how music can be therapeutic for tics and anxiety, and a chance to do some drumming. So day two of the adult track began with a workshop about social media and how it can be a great way to promote awareness, acceptance, and support for people living with TS. Rage and other impulse control disorders was an important session as well. So while rage outbursts are reportedly common, not much research has been done in that area. So this session gave a look at the clinical presentation, characteristics, and discussed evidence-based strategies. Other sessions for the day included a session on medical treatments for adults, such as medications and approaches to managing tics. And then the final session discussed coping with TS, and that even though there are challenges, you can still be a successful adult living with TS. And then the fifth track was for teens, and the content was really geared towards issues and strategies to consider as they become adults. So the first session was about finding your passion to achieve your future goals and seeing beyond your Tourette. Teens learned about executive functioning and strategies for the school, home, and relationships. And teens also learned about reactive rage and how to become more aware of how frustrations can build up and contribute to meltdowns. The session taught teens skills to recognize their frustration levels before it gets too high, and then also strategies to diffuse the anger and rage when it gets too high. And teens, too, also had a chance to participate in both the music and social media workshops, as I mentioned before. And then the second day focused on bullying prevention and strategies to address bullying when it is occurring. And then additionally, from a personal perspective, Brad Cohen, who was our keynote speaker, talked about how he managed his TS, including strategies for dealing with stress and anxiety in the classroom, how he educated people about TS in school and at his jobs, and how teens can be an effective communicator in dealing with TS. And then finally, the teen track wrapped up with a session on how to successfully handle social situations, such as feeling left out, asking for help, dealing with peer pressure, self-confidence, and much more. So now, I'm going to, now that you know all about the program tracks and what went on, I'll launch my final polling question. So for those who attended, or what conference track did you find most useful, or even those who didn't attend, which track would you have found most interested, in learning more about, if you were to attend? So we have some answers for teen, parent sessions. Just wait a few more seconds for a couple people to answer. Some people mentioned medical. All right. So hopefully this gave you a pretty good summary of our action-packed week at the conference, but even though the conference is over, we actually have many activities and events for you to look forward to, as John mentioned, and to participate in and keep the conversation going. So we actually have our awareness events, such as Awareness Month, which is taking place May 15th to June 15th. We have Team Tourette walks and runs around the country, as well as video storytelling. And stay tuned for more on our social media campaigns. So hashtag Tick Challenge is coming up for Awareness Month. And you can still use hashtag Rally for Tourette when participating in advocacy events. We will have a newly redesigned website set to launch May 23rd, which will be more user-friendly. It will also include blogs, videos, and a searchable resource center, along with many more interactive features. And keep an eye out for more Tourette health and education programs, including new webinars such as this one, Twitter chats using hashtag Tourette chat and hashtag Tourette _expert. We have new videos coming up, including selected presenter summary videos that were filmed at this year's conference, and toolkits for various audiences such as families and for providers. So we encourage participation in very different ways towards awareness, research, and support. And then unlike times in the past, we're actually now very active through social media. So be sure to follow the latest action on Facebook, Twitter, Instagram, and YouTube. And so here are all the user handles to follow us. You can also go to our website at tourette.org. And we post regular announcements and news via social media, and also love to see what other folks in the community are doing to raise awareness for TS. So we welcome you to share your thoughts, comments, ideas through social media. And so that's about it. So I think now we're going to begin to answer questions submitted through tonight's presentation. As a reminder, you can still submit questions to the questions panel in your attendee control panel. And I've included my contact information as well as contact for our information and referral staff. So support at tourette.org, or you can always give us a call by phone. So Megan, do we have any questions?
Muted. Thanks, Allie. So at this time, we actually don't have any questions, but we'll be here for a few minutes in case any come up. Unmuted. Muted. Like Allie mentioned, you can still submit your questions by using the questions panel to the right-hand side. Unmuted. Oh, looks like we have a question here. And it says, will there be videos of sessions of the teen track of the conference?
We actually did record some of the presenter videos, so that will be available, but we didn't record all the sessions from start to completion. In other words, we selected a few of the sessions, and we asked the presenter to give the 3 takeaways from the session, and even sharing 1 or 2 key questions that came up. But we did not record the entire session for each one. But stay tuned. We will have those to come probably sometime near when we launch our new website. So we're happy to take any other questions if people have them.
It is, are there any new strategies for tackling OCD?
Maybe this is a good question for Kathy to answer. Kathy, are you there?
All right. I am. Thank you, Allie. OCD is probably one of the more difficult parts of having Tourette, and we are encouraging people to look at anxiety because lots of times the OCD issues result in anxiety, and encouraging people whose children are interested in getting past some of their obsessive compulsive difficulties with some cognitive behavioral therapy. But OCD can be very difficult. It's important that everybody understand what the issues are for the student and come up with some plans, work with the child for some plans on how to reduce the anxiety around the obsessive compulsiveness.
Okay.
So we have another question here. It says, what are some of the note-taking or handwriting apps that help or helpers that were mentioned in the education track?
Kathy, this may be a good question for you as well.
Yeah. Actually, somebody from our Education Advisory Board, Margie, is an OT, and she is the one that did that presentation. So I would encourage you to email us, and we can get your question to Margie, who I'm sure would be happy to answer it. But I know she talked about, I haven't seen it, she talked about this pen that is just amazing. So send us an email, and we'll put you in touch with Margie.
Yeah, you can send an email to support@tourette.org and submit your question that way, and we will be able to direct it to Margie, who will be able to address that question for you with more detail.
Muted.
Okay, and we have another question here. It says, speaking of anxiety, will there be any info on coping skills for kids and teens to reduce anxiety, such as those mentioned by Brad Cohen that he uses?
Unmuted.
We have a really a new article on anxiety. It was written by another member of our Education Advisory Board who's a clinical psychologist who gives, and the article gives some really nice strategies on managing anxiety. So I would encourage you to look on our website under the education page. And if you are unable to find it, then again, email us, and we can send you a link to the article.
Thank you, Kathy. And any other questions that are coming in, Megan?
At this time, there are no new questions.
All right, well, maybe we'll just give it one more minute, and then we'll close out. But just as a reminder, when you leave the webinar, you'll receive a survey on the presentation, and we would appreciate if you would complete that and provide your feedback. You'll also receive a follow-up email within 24 to 48 hours with a link to view a recording of today's webinar. And we encourage you to reach out to us on social media about this webinar and other ideas and suggestions you have. If there aren't any more questions, on behalf of the Tourette Association, thank you again for joining us and taking the time to view our presentation. Have a good night.